Hello and welcome back to part 2 of Who Can Switch to Private Health Insurance in Germany. In part 1, we covered the basics of qualifying for private insurance, focusing on employed professionals with income above €73,800 a year and self-employed individuals. Now we'll look at other groups who qualify, dive into the crucial questions to ask yourself before switching, and, most importantly, with this video, I want to help you understand if private insurance is actually the right choice for your specific situation. Because here's the truth. Just because you can switch doesn't always mean you should. Let's continue with the other groups who qualify for private insurance in Germany. First, let's talk about the most straightforward group, civil servants, Beamte. Beamte don't need to meet any income threshold to qualify for private insurance. And here's the striking statistics. 94% of them choose private health insurance. That tells you something important, doesn't it? When those working inside the government system mainly choose private insurance, this speaks volumes about the differences in care they perceive. I would also describe this like that. 94% of civil workers does not trust the health care from their employer, German state. Another group is often overlooked. Students. They also have the option to choose private health insurance. Many insurance companies offer specially designed student tariffs that are competitively priced, often at similar levels to what students pay in the public system. This early decision for students can have significant advantage for them even in the future. They enter the system young and healthy, securing lower premiums. They avoid waiting periods and health checks later in life, and they get premium healthcare during a critical period of their professional development. However, even in this case, the decision requires careful consideration of their future career path and income potential. If you are not planning to stay in Germany long term, your considerations are quite different concerning private health insurance. In such cases, private system can be a smart option with better benefits and no long-term commitment. And this is why. There are special expat-friendly plans designed for international professionals. You can often get excellent coverage without the long-term commitment compared to people who live in Germany. Many providers offer English language service and documentation for international clients. These expat-specific plans often don't build up age reserves and are therefore less expensive. However, be careful. These plans are usually time-limited. If you decide to stay in Germany longer than planned, you'll need to switch to a standard private plan. That's why it's crucial to choose an insurance company that offers good options for transitioning to regular plans later. Beyond just qualifying, here are 3 essential questions to ask yourself before switching. 1. How's your health? Private insurance assesses your health when you apply and may exclude conditions or charge higher premiums based on your health history. They also can reject your coverage. 2. What's your family situation? Are you planning to have children? Will your partner work? These factors dramatically impact which system is better for you. 3. What are your healthcare priorities? Do you value preventive care, alternative treatments, or specific therapies that might be better covered by one system? After answering these questions, you'll need to evaluate specific plans. My video, Private Health Insurance in Germany, the 90% mistake, walks through exactly how to compare what's included and more importantly, what's excluded in different plans. Link is in the description. Let me be honest. Some people qualify for private insurance, but for their situation, staying in public is simply smarter. For example, if you plan to reduce your working hours significantly, then it would be such a case. Or if you have chronic health conditions that could make private premiums very expensive. If your income is unstable or varies a lot. If your partner might stop working for a long period of time. If you are nearing retirement and haven't planned for higher premiums. These are the typical situations where staying public is the safer choice or could be a safer choice for you. How to decide if private is right for you? Here's how to look at it. Private insurance is a good fit if you want fast access for specialists and top quality care, have stable, high-income career or business, plan to keep earnings high and well for the long run, don't plan to take long career breaks, or you are an expat who wants to retire in Germany, and of course, if you don't have any significant health conditions. Remember, there is no universal better system, only the right system for your specific situation. Now that you understand both who can and who should switch to private insurance, you maybe want to go deeper and make the right decision for your specific situation. Join my upcoming free webinar, Private versus Public Health Insurance in Germany, Making the Right Choice for Your Future. Sign up through the link in the description below. Or if you'd prefer to talk about your specific situation one-on-one, you can book a free, no-obligation consultation with me. That link is also in the description. Remember, this isn't just an insurance decision, it's a life decision. Your health is your most valuable asset, and the system you choose will impact how you care for it decades to come. Your health, your wealth, your future. I'm Natalia, and I'm here to help you navigate Germany's health insurance system in a way that truly works for your unique situation. See you in the webinar or in our first consultation. Bye!